Hey everybody, this is Dr. Reynolds, Dr. Caltrider, and Dr. Meredith with Healthcare Express. Here to talk about measles today, as there's been some reported outbreaks. So, measles is a viral infection that can infect lots of different tissues in the body. It normally presents with what looks like pink eye, cough, runny nose, swollen lymph nodes, and a rash that tends to start on the head and spread throughout the rest of the body with high fever. So, these patients normally look sick with a cough. The dangerous part about measles is you're contagious several days before symptoms start, up to 5 days before. It's spread through coughing, and once it's in the air, it can live in the air for up to 2 hours in a room that was in. 90% of people who are exposed to measles who don't have a vaccination will end up getting measles. It's important if you or your family members think you have measles to call ahead whatever doctor's office you're going to. Primary care, urgent care, pediatrician, let them know you're coming, because it's much safer to come out and swab and do the test in the car and keep that patient out of the waiting room, keep them out of the rooms inside the clinic, especially around clinics where anyone could be there who's immunocompromised in any way.
You need to remember that it's spread by air, and just by walking through the lobby or going to the exam room, it's going to be there for at least 2 hours. And so anybody who walks through that lobby is going to be exposed. So it's very important to be seen outside the clinic.
Absolutely, it's a very good point, Dr. Meredith, and especially, if you're wanting to minimize any risks that you're giving to anybody else, like Dr. Reynolds here said. I mean, you can have people with cancer, you can have people that have unborn children, pregnant women, any of those things.
Cases of measles are quite severe, and so it can eventually lead to an encephalitis and even death. And it can be several years after you get the measles. So it's real important to be immunized. I've seen one patient who had what's known as SSPE, which is a encephalitis, and he was in the hospital probably for 6 months and then eventually died.
The MMR vaccine has been around for a very, very long time. The studies support that it is a safe vaccine to get, and it is highly recommended to get it because it can protect you against life-threatening disease. If you're vaccinated, the odds of getting measles is obviously much, much, much lower.
And it's a different, basically, illness. It's usually not contagious. It's usually milder, but it's very unusual to have a vaccinated person get measles.
That's why it's highly important to vaccinate. And one of the things that I try to push on families to at least educate them on, anything that they would perceive as risks or benefits for their child. And I think you make a very good point. If you're not vaccinated, that 90% is incredibly high. And it also has, things that are not just this little cold that we think of. It goes much beyond that.